Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well, as usual. But I want to inform you and make you even better and more well-informed because of some craziness that I've noticed in the last year or two. And apparently it's just been epidemic, at least around here in these parts. And I want to talk to you about stopping the hormone madness. And that may seem a little bit exaggerated or exacerbated, but here's the thing is this. I firmly believe this, and I've seen this the last 22 years, as functional medicine, bioidentical hormone replacement, being a little bit more precise and personalized approaches to medicine based on hormones and hormone knowledge, and a lot of good medical books out there for the lay people, doctors producing books, naturopaths, chiropractors, nutritionists, etc. All wonderful, good, intentional stuff, but you still have to be approached in a personalized manner, and especially when you're talking about something from the endocrine system, the hormone system, something that is really that strong. Hormones are strong. Every cell in your body has a hormone receptor, so this cannot be taken lightly. So I'm going to give you a few tips, but when I say stop the hormone madness, normally I'm talking about taking a integrative, functional, personalized approach and make sure that you get your levels tested and you're not overlooked. Today I want to talk to you a little bit about something that I've seen. It's called overtreatment, super physiologic doses, things that don't physiologically make sense. So what do you get? Nothing but side effects, no improvement, and danger risks to using hormones. So you know me, I'm all about a functional systems protocol, and we practice something here very well and very efficiently based on that, so that we consider genetics and nutrition and gut health and how you detoxify and mind-body things and hormonal balance and genetics and pain and body stress interactions. But here's the thing is, what's most important is what's wrong, but you also have to be in a normal physiologic range. Yes, optimal range, but not super physiologic, okay? And I'm going to give you an example here, okay? But one of the most common things I see is thyroid overtreatment, okay? So yes, we want to make sure you don't miss low thyroid, or you're not missed as you have Hashimoto's, which is antibodies that are tested in your blood, or that somebody does the quality testing and looks at your free T3, okay? But let's pump the brakes here a minute, okay? It does not mean that you should have these super physiologic thyroid doses, and you can tell this if you are one of these people that might be creeping up there, okay, is that you should not have free T3 levels, okay, that are upwards in the 4, 5, 6 range. Never, ever. That is not normal. Or a TSH that is less than 0.0.0.0.1. Okay, that's crazy. You're suppressing your brain functioning in your TSH. Okay, levels that are creating a anxiety in you, or a tachycardia in you, or you have energy finally, but you're losing hair. Okay, so let's be sensible, be optimal in the upper quartile. Okay, not missed, not in the lower quartile. Okay, but let's be reasonable here. You should never have these kind of levels, because what do they cause? Tachycardia, atrial fibrillation, heart arrhythmias, strokes, hypertension, okay, osteoporosis long term. Well, you won't feel, but that's what you'll get long term. So you have to still be approached medically, and I say that again, medically, not a chiropractor, okay, medically, not a naturopath. They have no medical training under this in hormone replacement. And make sure that when you see somebody that is treating and assessing your hormones, okay, that they've had the experience and the training in hormone replacement, medical school, medical degrees, okay. And the reason I'm stressing that, and it might sound a little bit dramatic, but we've seen this trend in now that functional medicine is accepted and growing in popularity in that everybody's an expert if they just go to weekend courses or read a book. And maybe they have good intention and good intent, but these are the people that I see that then touch patients and actually get overtreated and get the negative effects. And that shouldn't be you or your loved ones, okay? Let me share a story. I gotta be careful about showing names. This is a female, and you can see here in this female, okay, 59 years old, okay, and you can see in this female, post-hysterectomy, small, 115 pounds, but this is a saliva test, okay, and you see those things circled, you see high levels of testosterone and DHEA and low adrenal function, okay. These are super physiologic, okay. And this is saliva testing, which we do, which is a very personalized approach. And you get really a body tissue level. But I also want to show you that we've done the testing in blood, okay? And let me cover her name in that. Again, a 51-year-old female. Testosterone level, hopefully you can see that, in the thousands. Crazy, in the thousands, testosterone. A male dose, which actually, male numbers, testosterone. You can see a free T3 level here of 6.23, okay? TSH barely detectable. Now we got her down to something more reasonable, still working on this by detoxing her and changing her doses. Thyroid down to 4.37, still a little high. Testosterone down to 167. This is a real person. You want to hear what happened with this person, which is scary? This person actually was working out and had a hypertensive response with exercise, went into atrial fibrillation and had a stroke. In the gym, healthy 51-year-old female. Overtreated, inappropriately, super physiologic dosing. This is very real. I've also had a patient that took excessive amounts of thyroid before, ended up with a arrhythmia of the heart, a supraventricular tachycardia, had to be put on medications and hospitalized for days. Because of excessive dosing and treatment, okay? This is something I see in the practice here. Obviously, we intervene and mitigate and get them on the right path again. And physiologically balancing them to an optimal, appropriate level, okay? Ironically, when I talk to these patients about their journey, about their story, about their path of how this happened, ironically, what is told to me is that they typically just had lower energy, and somebody that wasn't a medical physician was giving them guidance, or it was a physician in the background, and they were following some type of protocol that the practitioner or somebody that was non-medical had read in a book, and they called it the Dr. blah blah blah's protocol. So be informed, ask questions to your provider. Bring in good questions and knowledge. Question them. They shouldn't be bothered by the questions as long as it's respectfully, and know their background, know how many patients they've treated medically, especially when they're dealing with your hormones. Know actually that they've been practicing for years and years, not a year and not weekend training, okay? Know what you're getting, okay? But also remember this. When you have levels, because you can see your own labs and get your own results, that are super physiologic, whether you feel good or not, there's always a price to pay. When you're out of range and not reference range, we've talked about this in previous labs, but super physiologic ranges that you're guaranteed to get problems eventually, okay? You're really gambling. You're playing some roulette, so be careful, okay? This is to inform you and to enlighten you, not to scare you, okay? And this is coming from somebody with a lot of experience treating bioidentical hormones, treating thousands of patients, being extremely busy in a medical practice, but treating you as a whole in a very personalized, holistic way, okay? But not over-treating you. And I think that's very, very important. So hopefully this is accepted and taken well. I don't mean it from any other place than knowledge and reference and love and purpose, okay, to do the right thing. But I also have been seeing this trend lately, and I think it's because in a good way, there's a lot of good knowledge out there, books, blogs, videos, similar to this, okay? But then a patient may come across a provider or practitioner that is not as experienced and not looking at you in a very individualized, personalized way and considering everything. You are a whole person, genetically, molecularly, chemically, hormonally. You have to be considered as a whole and very individualized, okay, and not excessively treated. So this is Dr. Lewerenz. Stop the hormone madness. Get balanced. Be optimal, but get balanced, not overtreated. We're in Rochester Hills here, Madison Heights here, soon to be Bloomfield. Me and my practitioner is happy to help and inform you. Follow us on the web, follow these videos on Facebook, and we'll always have more informative information and enlightening information coming to you soon. And this is Dr. Lewerenz. Be well.